I talk to Dr. Jordan Soll here in just a moment, along with Dr. Stephen Mulholland, but here we go with the next story. After Shannon's nose surgery, it was time to straighten her teeth. Under the expertise of you, Dr. Jordan Soll, she received veneers and an instant solution to her problem. Watch this.
Yeah. There you are. This runs for 15 minutes.
So initially, Shannon came to us. She was unhappy with the appearance of her smile. When sort of pinning her down, she said she didn't like her top teeth. Shannon's getting her bottom teeth whitened because this is sort of the moving target. We'd like to see how white these bottom teeth get. This is going to be how we base on the color of the restorations for the top teeth. Then, using a fairly strong hydrogen peroxide derivative, it was painted on the teeth, and then a strong white light is used to activate the material. And it's simply an oxidation process where little oxygen bubbles penetrate the teeth, liberate the stains, and then remove them from the teeth. Veneers are actually very thin shells of porcelain. I sort of refer to them as aluminum siding for your teeth. We're able to reshape the teeth, and using these thin shells of porcelain, we can correct the color, and we can correct the shape and contour. Using our bonding agents, both the internal surface of the veneer and the tooth are coated. We then use a resin. The veneer is adhered to the tooth, gently put into place. Once we confirm that the veneer is sitting correctly, it's then bonded. In other words, we use a high-intensity white light, and the white light cures the cement. I think the greatest benefit is the psychological, how great they feel afterwards.
Right. Dr. Jordan Soll, welcome. There's a lot. We were just, Dr. Steve and I were talking about the coordination that the two of you had to do when it came to Shannon. And first she came to you. Is that what happened? She had what? Something with her gums that you had to do.
When we examined Shannon's teeth, the gum tissues weren't in the correct positions.
Right.
And so some of the teeth appeared longer, some of the teeth appeared shorter.
Okay.
So you wanted to put the gum tissues in their correct positions so that everything appeared in a natural order when complete.
So that was done. So you had to have a little time and space before you did the rhinoplasty?
Yeah.
Yeah, so that took some coordination as far as time is concerned. So how much time was that? A couple weeks or?
About 2 weeks? Yeah, it takes about 2 weeks.
Okay.
And generally when I look at faces, I look at the smile all the time and send patients to Jordan, because what's a lovely face if you can't enjoy it with a lovely smile?
Right, right.
And so teeth and hair and makeup, they just all integrate into what is a harmonious, natural-looking appearance.
So then she got the teeth. Now, do you put in, like, when you do this process, and we didn't see all of it there, obviously, but when you do this, how much time do we have to allow for the initial meeting with you to when the actual veneers are put on? Because don't you have to measure and do all that sort of thing? And
when we meet with the patient, it's usually for initial consultation.
Right.
We answer their questions, address any concerns that they have. And if they decide they want to go to the next process, I spend about an hour and a half, and we measure their gums, measure their teeth, we take x-rays, take models, and then in fact on the model we will actually do the work.
Oh, really?
Similar to what Dr. Mulholland did with the computer imaging, we will actually recreate these veneers on their stone models to make sure that the top and bottom teeth will bite together nicely when complete.
okay, so then when we come and see you, do you have to kind of, for them to adhere, you have to kind of, put some, you know what I mean? I'm gonna try sandpaper. I'm thinking, grinding. Like, what has to be done to the initials, the original surface?
Once we go ahead with treatment, it depends on what each tooth needs.
Yeah.
If some teeth are positioned more towards the back of the mouth, well, then very little work has to be done because we're simply going to bulk it out.
Okay.
But if some teeth are more forward, then we do have to reduce the thickness.
Do you have to have, if your teeth are not in good shape, in other words, they're crooked, do we have to have braces and get those straightened out before we see you?
Each case has its own merits.
Okay.
Sometimes yes, sometimes no. It's not easy just to give you a blanket answer one way or the other.
Okay, so each case is different. All right, so then, how young will you do veneers? I'm hearing really like 16, 17-year-olds like to do veneers.
That's pretty young. However, if they have very, very small teeth where we do not have to reduce the tooth and we're actually just veneering over the existing tooth structure, 16, 17 is just fine because you're not touching the enamel. You're actually bulking out.
Okay.
So again, each case has its own merits.
And how long do these veneers last?
Depending on how well the individual takes care of them.
What do we stay away from, food-wise?
You don't want to be gnawing on chicken bones, spare ribs, peach pits, all the things that would, it's really common sense, all the things that would chip your natural teeth.
Yeah, okay, and then when it happens, okay, the cost, first of all, the cost of when you get, it depends on each case, but relatively speaking, the cost of getting veneers done, Jordan.
Each veneer can cost between $750 up to $1,500, $1,700, and there's really a lot of price options. And so what the consumer really has to ask is, one, is the clinician going to have a good appearance, a good overall idea of the appearance that the patient wants in the end? And there's also something that most of the consumers don't realize is, who is the ceramist making these veneers?
Okay, talk to us about that.
You can get a production line ceramics, or you can get a master ceramist where he will just focus on this one case and create all the nuances that nature intended. So there's a huge discrepancy in the cost of a veneer that we purchase from the lab.
Okay.
But often the consumer, they're not aware of that factor.
Okay, and it's when you go in, depending on the case, you can get all your veneers done in one...
2 visits.
2 visits.
First visit, we prepare all the teeth, we take the detailed impression, and then we put temporary veneers on. During, say there's about a 10-day wait, and at that time, the master ceramist is creating these veneers, and so the second visit is bonding the veneers into place.
And then right after, should we eat before we see you on that second appointment? Because are we going to be afraid to use them once we get that done?
No. For the first few
I know, Jordan,
few days.
so it's just like, can we eat now? Okay.
For the first few days, you're going to feel a little awkward, but then getting used to them, readjusting, you'll be just fine.
In your office, who's getting them done more, men or women these days? More men?
Still women.
Still women.
But more men are stepping up to the plate.
Okay, good stuff. Well, she looks beautiful, you guys.
Thank you.
She does. She's right over there. Shannon, you just wave at everybody. Have a great day, everybody. Good show.